Chevallone with a CTV News update. A memorial was held today for U.S. Capitol Police Officer Brian Sicknick, who died in connection with the insurrection at the Capitol last month. Byron Scott has our story.
That somber service began early this morning under the rotunda of the U.S. Capitol, the building where Officer Brian Sicknick served. Lawmakers, family, and colleagues gathered to honor the man who died defending democracy. It was January 6th. A deadly pro-Trump mob attacked the Capitol. It was during that violent attack that Sicknick was injured. He died a day later. Lawmakers offered comments. Here's some of what they had to say.
The book of Matthew reminds us, "Blessed are the peacekeepers, for they shall be called the children of God." Today we gather to honor Officer Brian Sicknick, a New Jersey native, a National Air Guard veteran, and a 12-year member of the Capitol Police Force. A peacekeeper, not only in duty, but in spirit.
And we know from his service on the Capitol Police Force how patriotic he was. We gather today united in grief, gratitude, and solemn appreciation for the service and sacrifice of Officer Brian Sicknick. We respect his service certainly as a member of the Capitol Police Force, but also as a patriot to his country.
Following that service, Sicknick's cremated remains were taken to Arlington National Cemetery for burial. I'm Byron Scott.
Calling the riots at the U.S. Capitol abhorrent, Prince George's lawmakers passed legislation to investigate any county officials who took part in the January insurrection. Sponsored by Councilmember Monique Anderson Walker, it would sanction any official who was involved in rioting.
We want to send a message that Prince George's County is not going to be friendly to any of that activity and to anyone who wants to disenfranchise voters. We recognize that that insurrection was clearly an attack on democracy, and it revealed the fragility of our nation. As Americans, we want to shore up America, not tear it down.
And the County Council passed the measure last week. Congressman Anthony Brown testifies before the Maryland General Assembly on health disparity issues. Brown went before the Health and Government Operations Committee to support the Maryland Health Equity Resource Act. The measure would create a program modeled on the Health Enterprise Zones initiative that Brown had championed when he was lieutenant governor. The program expired under Governor Hogan.
Through this innovative approach, the program and its administrators were able to address complex socioeconomic issues in those underserved areas. The results were a resounding success. According to a 2018 Johns Hopkins study published in Health Affairs, HEZ saw a decrease of more than 18,000 inpatient stays during the pilot program. This resulted in a savings of over $108 million in healthcare costs, far outweighing the $15 million cost to implement the program. And we were able to reinvest these dramatic savings back into our communities to further improve health outcomes.
Brown has introduced a similar bill in Congress in hopes of taking the initiative nationwide. Maryland's Democratic congressional delegation is calling on the governor to improve the state's vaccination plan. The members wrote a letter to Governor Larry Hogan asking him to create a one-stop website that allows Marylanders to make vaccine appointments. The Democrats want the state to come up with a strategy to address the disparities in vaccine access. Lawmakers also want state health leaders to work better with local jurisdictions. As COVID-19 vaccination efforts ramp up, many people are still hesitant to get inoculated. One local hospital system is addressing these concerns with the vaccine task force. Dr. Joseph Wright with University of Maryland Capital Region Health says that the hospital is holding several events to help people better understand the vaccine. He says some people falsely believe that the vaccine will give you COVID-19. He says others are worried about the speedy development of the immunization.
We have had the genetic roadmap to develop this vaccine for some time, and all of the necessary steps taken to test the vaccine and to conduct the trials, particularly the phase 3 trials in members of our community, have been taken, and those shortcuts were taken to get to the emergency use authorization.
For more information about COVID-19 misconceptions, visit umms.org. The state health department reports a declining number of new COVID cases. In the last 24 hours, 942 Marylanders tested positive for the virus. Maryland has recorded 357,000 infections since the pandemic began. Meantime, 31 COVID deaths were reported today. Meantime, to answer any questions you might have about the COVID-19 vaccine, County Executive Angela Alsobrooks and Dr. Anthony Fauci are conducting a discussion next Monday at 2 p.m. Prince George's Health Officer Dr. Ernest Carter and the University of Maryland Capitol Region Health will also participate in the event. It will be held virtually. For more information, you can visit the link on your screen. State and local officials are lobbying once again to bring a new FBI headquarters to the region. During the Obama administration, Prince George's was on the short list for the new site with 2 of 3 possible locations in the county. But the Trump administration nixed those proposals. Now, with President Biden in office, lawmakers are hoping to go back to the original plans. Governor Hogan recently wrote a letter to FBI Director Christopher Wray reiterating the state's support for placing the headquarters in Maryland. And you are watching CTV News. I'm Patricia Vallone. Stay right where you are. We'll be right back.
For the latest information on COVID-19 in Maryland, visit the State Health Department website. That's health.maryland.gov. Again, health.maryland.gov. Click the link to the COVID-19 information portal. There you'll find all the latest information about coronavirus. You'll find daily updates on cases and fatalities. Answers to questions about testing and the governor's stay-at-home order are available as well. For specific information about Prince George's, visit princegeorgescountymd.gov. That's princegeorgescountymd.gov. The site offers information about local services for residents and businesses. There's a link for COVID-19 relief donations. Also, food pantry locations are listed. And if you have any questions, call the county COVID-19 hotline at 301-883-6627. That's 301-883-6627.
Welcome back. Unions and education advocates renewed their push for collective bargaining rights at community colleges. According to Maryland Matters, more than half of the faculty at Prince George's Community College is made up of adjunct professors who don't have employee benefits or collective bargaining rights. A new measure before the General Assembly seeks to expand those bargaining rights to employees at all of Maryland's 16 community colleges. Similar bills have failed in the past, but this year, union leaders say they have more support for the measure. Governor Larry Hogan will deliver his State of the State address, but this year it will be a little bit different. In the past, it was done in the middle of the day during a crowded joint session in the House chamber. But this year, due to the pandemic, Hogan will deliver his speech virtually this evening. For the first time, the State of the State address will take place at 7 p.m. tonight. It will be available to watch on the governor's Facebook and YouTube pages, as well as broadcast live on Maryland Public Television. Prince George's police need your help finding the suspect or suspects who fatally shot a 32-year-old woman in Riverdale. This is the victim, Shantice Gideon. Officers were called to the 5300 block of Hamilton Street back on January 29th. They found Gideon in a parking lot suffering from multiple gunshots. She died later at a hospital. Investigators do not believe this was a random attack. Anyone with information on the incident is asked to contact Crime Solvers. Well, it wasn't long ago when you could face criminal penalties for using marijuana to treat physical ailments. Today, not only is medical marijuana legal in Maryland, but you can also get a degree to study it. The University of Maryland School of Pharmacy is offering a graduate program so students can learn about the history, science, laws, and ethical issues related to medical cannabis.
Kind of our vision and our hope that our program helps to legitimize cannabis as a medical treatment, and we try to, we teach the evidence that we know and the science that we know about now. Now, there's obviously a lot that we don't know about how cannabis works to treat medications and symptoms. So we anticipate our program will continue to grow and evolve as science policies and medical evidence also changes around medical cannabis.
And what do you think the reason is for the growth in this program? Is this a big moneymaker for people in terms of a career?
The careers in medical cannabis, like everything in medical cannabis, are still evolving. Certainly, we do have entrepreneurs in our program. I think that there's a lot of potential, but we also have, clinicians, physicians, pharmacists, nurses in our program that hope to take what they've learned back into their own medical practice to help manage patients.
For more information on the graduate program, log on to pharmacy.umaryland.edu. As we continue to celebrate Black History Month, the Department of Parks and Recreation has many interesting activities to consider. Throughout the month of February, the agency will host events that will engage residents in conversations about Black history. This year, there will be more than 25 programs, including virtual performances, history lessons, panel discussions, and workshops. The national theme this year is the Black family, representation, identity, and diversity.
Have a panel discussion that looks at the relationships between the Black family and music. At the end of February, we'll have a program that's our actually an annual program, which is our African American Family Day Festival. And so that will be virtual this year, but it's an annual program that's put on every year in the department. And then for us internally, we also had a theme that we focused on Black healthcare. And so we have, like I said, a virtual exhibition that's entitled Black Health Matters. And so we're looking at the history of African American healthcare and healing traditions.
And to register for the events, visit blackhistory.pgparks.com. Let's get a quick check now on our 3-day weather forecast. Tonight, mostly clear with a low around 25. Thursday, sunny with a high near 44, a low of 34 degrees. Friday, rain and showers, snow showers that is, are likely in the morning with rain showers increasing throughout the day. Temps will reach a high near 50 and a low of 28. Saturday, sunny with a high near 43 and a low around 28. And now for your community calendar. Attention District 6 residents. School board member Belinda Queen, along with other local organizations, is hosting story time for students throughout Black History Month. Join the virtual activity every Saturday this month. Students ages 5 to 8 will log in from 10:30 to 11 a.m. And those age 9 to 12 years old can jump on at 11:30 to 12:15. Register today by emailing the address listed on your screen. And for more information, you can visit pgcps.org. And that wraps up our CTV News Update. Join us again tomorrow at 4:30. Have a great night.
I am what child hunger looks like in America. I am a 9-year-old boy who hopes a friend invites me to a sleepover so I can have dinner. I am a 15-year-old girl who goes for walks during lunch, so my friends won't know I don't have anything to eat. I am a 13-year-old boy who gets into fights at school just because I'm hungry. I was created by artificial intelligence from faces of the 1 in 7 American children who struggle with hunger. Kids you pass by every day, but never knew they were hungry.
Feeding America, 200 food banks strong.
I moved to Florida with literally pennies in my pocket and a prayer. I needed a new start. Dacian looks like a very typical 3-year-old until you ask him, "What's your name? How old are you?" My son has a lot of behaviors that would show as being autistic. Most kids can tolerate a variety of foods, but unfortunately for Dacian, everything has to be organic and raw. I wasn't ashamed to go to the food pantries. It's expensive to eat healthy, and nutrition is very important to Dacian's health. The healthy organic food that we receive dramatically helped his social skills. Most people would say, she really doesn't have much of a life. But to me, I have everything right there next to me in my son.